when you treat a disease, whatever it is, you can specialize in any disease. But one thing is very important. It's, as Dr. Samuel Hahnemann said, the knowledge of disease. You should give emphasis to that, the knowledge of disease. Renal patients go to a nephrologist not because he has cured hundreds of renal failure, right? Because his qualification guarantees his knowledge about the disease. That is what I think we lack. So that's knowledge of disease. So treating the disease, you should know about the disease, the stages, the prognosis, the complications, the investigations, because that is the factor which is going to give the patient the confidence. If you have knowledge about the disease, the patient will stick on to you, because nowadays the patients are well educated. So once they are diagnosed as they have a problem with the kidneys, they will search the net, they will grab the maximum knowledge about the particular disease, then only they come to you. You can't expect the patient to directly come to you once immediately after the diagnosis. They have to be convinced that there is nothing much to do in modern medicines. Then only they will opt for some other sources. Second, again I will put the word from the organon, it's the knowledge of medicine. Of course, your knowledge in materia medica. Of course, the relationship. So these put together will make you a very successful practitioner. Selection of potency, etc., 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 etc. To my knowledge, being in this field for past 18 years, I feel that it is from sheer experience. All successful practitioners has got their own criteria of selection of potencies, selection of medicines and repetition of medicines. But of course, when you take a class, it will be put in such a way that maybe I gave one dose of Belladonna 30 and cure the entire episode. That's the theoretical aspect. But when it comes to the practical side, it may not be like that, especially in diseases where there is grave pathology. Here, a patient comes to you with an elevated creatinine levels. After a first prescription, it is your responsibility to bring down the creatinine at least 0.2 to 0.3, right? Otherwise, the patient will not have confidence in you, rather the patient will never stick on to you. That's the first thing which you have to give. Secondly, the general condition of the patient may be very bad. He may not be having appetite, he may be lethargic, he may be weak. Improve the general condition, the patient is satisfied. Rest, everything comes after that. So when you manage a chronic renal failure, you have to always give emphasis to these two aspects: improving the general condition of the patient and improving the renal function parameters. Now you have enough time, the patient has got confidence in you, okay, you can do something on that. Now you can work on it. The function of the kidneys and glomerulus. It excretes waste products, especially the nitrogenous and sulfur containing end products of protein metabolism. These all things you know. I am so sure that you are aware of it. And it helps to maintain the hydrogen ion concentration of the body fluids and electrolytes. The electrolytes, very important factor. Mainly two electrolytes, sodium and potassium. And it helps to maintain water balance of the body and thereby plasma volume. When you think about the sodium and potassium, in all chronic renal failure, the sodium level reduces and the potassium goes high. It's called hyponatremia and hyperkalemia. I'll tell you a small example. One of my patient, he became very what do you call? He was talking without any relevance. He had severe disorientations and he couldn't even recognize his children. He was taken to the hospital, admitted in the hospital. They did all investigations, including an MRI brain, but no findings. Then they invited a nephrologist. The nephrologist came, he examined the patient and asked the patient to hospital authorities to check the serum sodium. The serum sodium was only 101. The normal value is 130. From 130, okay. He asked the duty doctor to give 2 to 3 pints of normal saline, and the patient was absolutely normal. There lies the diagnosis. So, whenever a patient is lethargic, disoriented, you have to check the sodium of the patient before prescribing Nux moscata, okay? Because that's where you need to know about the physiology, because it's a main neuroconductor. It transmits all the messages, it regulates the brain function. So, that is regulated by the kidneys. More often what happens is that, especially in the daily practice, we find whenever a patient is diagnosed with hypertension, the patients know a little bit that salt has to be restricted. It's like salt has to be restricted. In none of the literatures and none of the books it is mentioned that you have to avoid salt, because you need 5 grams of salt for sustaining a normal physiological function every day. But if your husband is deceased, the wife says, no, from tomorrow you are not going to take any salt. And husband also feels, okay, good, my BP will be under control. So, after a few days or few months, what happens is that the serum sodium level will come down and the patient becomes disoriented. Now, then the potassium. As you all know that the potassium is a very potential what toxin? Which organ is the first affected due to increased potassium levels? Yes. Heart is the first, it's potential cardiotoxin. So, and it helps to maintain the optimum concentration of certain substances in the blood by the process of selective reabsorption. We have just crossed that selective reabsorption, because the function of the kidneys are very important. It is filtration and selective reabsorption. First, the kidney filters the entire blood, then forms the filtrate. From there, it grabs the essential, like how you grab your luggage in a conveyor belt now. When it goes, you will grab your luggage. The same way, the kidney first filters, then grabs the essentials. So, that is first is filtration and essential reabsorption. It eliminates drugs and various toxic substances from the body. It manufactures certain new substances, that's ammonia, hypuric acid and inorganic phosphates, and ammonia helps in preserving the acid-base equilibrium. And it helps in maintaining the osmotic pressure in blood and tissues. That's why when the kidney fails, there is edema and anasarca, right? Because the kidney helps to maintain the osmotic pressure between the blood and the tissues. It helps in regulating the blood pressure during hypoxia in conditions of emergency through the liberation of renin from the juxtaglomerular apparatus. And it helps in the regulation of erythropoiesis